Minister, for coming into the House and taking this matter on the adjournment. And the issue I have to raise is in relation to the ambulance service in Kerry, and particularly the ambulance service in South Kerry, which as of last Tuesday has been changed significantly, and I believe that in a way that will have detrimental consequences for patient safety. The issue is quite simple. Killarney town, which services a huge catchment area, a population of 20,000 in the town itself. Obviously visitors during the summer increase, swelling the population to 40,000 and at times 80,000 of a weekend, has now come to a situation where of its 2 emergency ambulances, 1 has been withdrawn. So the town of Killarney and its surrounding areas have a cover in relation to emergency ambulances that is far from satisfactory. After a huge campaign in the Kinmare area, we managed to retain the ambulance there, and also Carsavine has its ambulance retained as well, and I refer to emergency ambulances. But due to this policy of dynamic deployment, which means that ambulances will be moved as soon as they are activated in other areas, we could see a situation where, as has happened in other places, has happened in Middleton, as you're well aware, where ambulances aren't available when they are necessary. And I believe the loss of an emergency ambulance, a reduction of 25% of the cover in the South Kerry area, will have life-threatening consequences. And unfortunately, I will be back here in this chamber reporting on those incidences and calling for the restoration, as I am now, of the 2nd emergency ambulance in the town of Killarney, which services the entire South Kerry area. Thank you. That's good.
Thank you, Cathaoirleach. And I am taking this debate on behalf of the Minister for Health, James Riley, and I do thank the Deputy for raising it. A significant reform programme has been underway in pre-hospital emergency services in recent years. This is to ensure that the best clinical care is provided for the people in each region that the National Ambulance Service serves, through provision of a clinically driven, nationally coordinated system, supported by improved technology. As part of this process, the NAS, that's the National Ambulance Service, has implemented a new model of pre-hospital care service for the people of South Kerry. This new model is for a region-wide service. It has replaced the former local delivery structure, and it allows dynamic deployment and optimal use of emergency resources. It came from analysis of the needs of the South Kerry area and the best use of emergency resources, including paramedics and advanced paramedics. The modernisation of service delivery in South Kerry follows a consultation process with interested groups in the region, such as GPs, local public representatives and community groups. The plan was also informed by the modernisation that has already taken place in Cork. The new structure agreed between HSE management, union representatives and staff provides numerous benefits for patients. It includes replacement of on-call with an on-duty rostering, so that service delivery in South Kerry is in line with the majority of the region. On duty means that during a shift, paramedic staff are at their base or in their vehicles, ready to be dispatched immediately to the 112 999 calls, not waiting at home to be notified with the delays that involves. Regional deployment of emergency vehicles and emergency personnel for wider availability of ambulance resources to best serve the people of South Kerry. An intermediate care service for routine transfers of patients between acute and community hospitals in line with best clinical practice, freeing emergency vehicles in South Kerry for emergency work. Retention of Killarney, Carsavine and Kinmare ambulance stations at the location for deployment in the South Kerry area. In a modern emergency service, treatment begins when emergency staff arrive at the scene of an incident. Patients are assessed, treated and stabilised before being transported to most appropriate facility. The NAS has highly trained health professionals in South Kerry as paramedics and advanced paramedic level who can perform life-saving interventions and other skilled treatments at the scene before moving the patient safely to an acute facility for further treatment. While there have been some concerns raised around levels of cover at certain ambulance stations, I am assured by the National Ambulance Service that this plan will greatly improve response times, as emergency ambulances will be available straight away and where necessary. Ambulances from adjacent stations will provide dynamic cover, move to areas where cover is required. In conclusion, the new arrangements which I have outlined provide an extra 126 resource hours each week between Killarney, Kinmare and Carsavine stations. The move to on-duty services also means that the whole of South Kerry will have a 24-hour-a-day, 7-day-a-week emergency ambulance service. This means that the people of the region have timely access to highly skilled paramedic and advanced paramedic staff day and night.
Thank you.
Supplementary now briefly.
Yeah, thank you, Minister. Thank you for giving that reply on behalf of the Minister, James Riley. I suppose what we are facing in South Kerry is death by geography and death by PowerPoint. We had been given a PowerPoint presentation by the National Ambulance Service, and hidden in all of that was the loss of the second emergency ambulance in Killarney town, which beggars belief. Which means that people who are living in rural areas are now going to be waiting an hour, 2 hours for a response to heart attacks, strokes, which, as you know, by the time they get to hospital will mean that the health service will have beds which are taken up by people. If they had gotten emergency care quicker, would ensure that they would have been out in hospital in days, and now it's going to be weeks. I suppose, Minister, the National Health Service and the HSE have made their decision. The town of Killarney are at a loss, and I'm afraid that despite the promises that it will be a better service, I'm afraid that there will be fatal consequences for people in Kerry.